just going to show my surroundings. I have a garbage can over there and my supplies. Surroundings, no one else is in here. Okay. So I feel like I can't position this no matter what I do. It's not that good. So, Holly, I hope this isn't too bad. Okay. So I will be doing a quick brain dump. Before I start. This is my paper. Okay. No idea what that was. Okay. Hi, my name is Danielle. I'm going to be your student nurse today. I am performing hand hygiene and I'm providing privacy. Here, let me just tilt this up so you can see me. Okay. There we go. Okay. Hi, my name is Danielle. I'm going to be your student nurse today. I have provided privacy and I'm performing hand hygiene. Can I get your first and last name, Josephine Smith, and your date of birth, 10/15/53? Okay, I'm going to check your wristband. Looks like that's right. So I heard you have some troubles voiding today. The provider's orders looks like we're going to be, the doctor ordered me to perform or insert a Foley catheter tray. Is that okay? Yes. All right. So, do you have any troubles voiding? Do you have any? When was the last time you voided, Josephine? This morning. Okay. Do you have any allergies to iodine, shellfish, or latex? No. Do you have any other allergies? Yes. Sulfa and betadine. Patient is alert and orientated ×4. Do you have any limitations on voiding, or do you have any limitations on joint mobility? No. Do you have any have you ever had any issues with catheterization in the past? No. Have you had any gynecology surgeries recently or in the past? No. Okay. And the last time you voided was this morning, you said. So, first what I'm going to do is I'm going to uncover you. Josephine, are you comfortable right now? Yes. Okay. I am going to be uncovering your lower half here. Okay, and I'm going to put your gown up. I'm going to do an abdominal assessment. I'm looking for any tenderness, bloating, or abdominal distension, and she has none of those. The bladder does not feel distended, so all of that is good. Now what I'm going to do is I'm going to locate the urinary meatus, and I'm going to clean the area with my clean, this is dry, but we're going to pretend it's wet, going from one side, change locations, middle, other side, and then dry, Okay, and I will discard that appropriately. And Josephine, for this, we are going to have your knees bent, like knees bent and like out. Maybe I shouldn't do that. Yeah, I will. Okay. Knees bent and out there. I hope this is okay. What did I say? All right. Okay, now I'm going to discard my gloves into my trash can here. I'm going to perform hand hygiene. Okay. And now I'm going to set up my, I'm going to move my trash can first. It's just in my way a little bit. Okay, so I have my bed and my bedside table raised to appropriate height. I'm going to open up my catheter. Oh wait, before I open it, I'm going to look at the integrity of the package, which is good. The contents of this pre-closed system is 1 silicone coated fully catheter, 12 French with 5 cc's, and that is what the doctor provided, so that's correct. I have 1 2,000 milliliter drainage bag, 1 bed sheet clamp, 1 10 cc syringe pre-filled with sterile water, 2 medium vinyl gloves, powder-free, 1 waterproof drape, 3 PVP swab sticks in a pack, but I will be using these isopropyl alcohol swab sticks, not the iodine ones. 1 lubricating jelly packet, 1 specimen container, 1 patient label, 1 packaging overwrap, a procedure tray, and an insert label. This equipment has not been expired, and it is sterile. So I'm going to, it expires 12/28 of 24, so it's not expired. I'm going to open my package like so. Put this here. I'm going to take this off and put it here. I have my this, which I will fill out later. And now I'm going to maintain sterility while opening the package. So I'm going to take this corner and fold that down. I have another corner here. I'm going to fold outward and this corner, and I'm going to place it right here, remembering that I have a 1-inch border around that is sterile. So I'm just going to flatten this out here. Open it. I have my sterile glove packet right here. I have my drape, which I'm going to grab the corner of. This is the drape that will be going underneath. I'm just going to flatten it out here. I'm going to go like this. Making sure I'm not reaching over the patient. I'm putting this down, flowing it in the appropriate way, and I'm just tucking it underneath a little bit. I think I did it. Yeah, I placed the towel down so that the non-sterile side is down and the shiny side, sorry Josephine, and the non-shiny side is also down. I now have my sterile drape. Okay, which I will be using on my female. I'm not going to be So making sure I'm going to switch my sides here, making sure I do not cross my barrier for sterilization, and making sure that it is covering appropriately. Now I'm going to get my gloves and put on my sterile gloves. I have performed hand hygiene. I took off my watch and my ring. I do have a band-aid because I have a pretty bad cut on my thumb, but I'm going to leave that on for the sake of this video. I'm going to open my gloves here. If it's gonna stay. Okay, starting with my dominant hand, only touching the outer ring. I'm going to put these on. I'm touching the inside of the cuff and making sure I don't touch my skin because skin is not sterile. Just going to pull my cuff down, and then I'm going to throw this away. Keeping my hands above my waist to maintain sterilization. I'm not going to be using my antiseptic, my iodine thing. I'm going to get this here. I'm going to get my tray ready. I'm just going to move this over and get my tray ready here. This is my specimen cup. I'm going to set to the side because I'm not going to be using. I'm going to prepare my catheter and take this part off, throwing this away. I'm going to get my lube here and open it. And I'm going to place my the end of my catheter inside my packet so that that part is ready to go. I am going to take my sterile water and syringe. I'm just gonna get the air out and secure it onto my, and secure it onto my catheter. And I'm going to open my saline, my sterile alcohol wipes so that it is all ready to go. Okay, now I'm going to pick up my container and place it in my sterile field as so. I'm going to be using this hand to open the labia. I have located the urinary meatus. I'm going to use my sterile swab to clean the area, going from the top down, and then discard. Skin is not so sterile. In a real situation, I wouldn't do that. The patient would be holding their legs. I'm gonna go to the other side, discarding and cleaning down the center. Discard. I'm going to discard this so it's out of my way. Now I am going to take the lube. I'm going to take my lube catheter. For a female, I will be placing it 2 to 3 inches in, and then that is when I will get urine flow. I will then proceed 1 to 2 inches after that. For a male, I would do 8 to 9 inches and then proceed 2 more inches. So I'm going to get my lubed catheter. Keeping it sterile. If I can get it, oh, it's okay. My lubed catheter, and I'm gonna hold it about 1 inch from the top. You are going to feel a little pressure, Josephine. Take some deep breaths. Inserting the catheter, 2 to 3 inches. I have urine flow, and I'm going to insert it 1 to 2 inches more just to make sure that it stays. I'm going to put 5 cc's of sterile water into my balloon so that it stays full, so that it stays in place. And I will discard this. This can be discarded. Okay, and then I would appropriately fasten the catheter to the patient's leg and hang this. For a sterile sample, I would place a paper towel on the floor. Beneath it, I would grab my sterile cup here. I would empty the catheter, and then I would empty the catheter and make sure to clean the drainage tube and the and where the drainage tube goes into with an alcohol swab to keep it clean. I'm going to take off my gloves appropriately, not ripping them. I would discard this. Josephine, you can move your legs down and get comfortable. I would discard this. I'm going to appropriately do that. Is there anything else I can do for you today? No. Okay. I'm going to lower the bed all the way, making sure it's locked. I am going to perform hand hygiene and document accordingly and clean up my area. Is there anything else I can do for you today? No. Call lights in reach, bed is lowered, locked, inpatient is comfortable. And that's my video.